Welcome to Pikeville Medical Center. Our mission is to provide quality regional health care in a Christian environment. Thank you for choosing Pikeville Medical Center for your health care needs. Our goal is to support you in every step of your upcoming procedure. As you get ready for your left heart catheterization, or LHC, we will provide you with information to prepare you for your hospital visit. Your upcoming procedure is done to evaluate the condition of your heart. We will be explaining the left heart catheterization, or LHC, a procedure that is performed on a daily basis at Pikeville Medical Center. The procedure has traditionally been performed through the groin. However, Pikeville Medical Center is currently entering through the arm, or transradial, whenever possible. Generally, about one-half of the procedures are transradial. During this minimally invasive procedure, the cardiologist injects contrast or dye into the arteries of the heart. The heart is a muscle that is supplied with oxygen simply by the blood flow through these coronary arteries. When someone has a blockage, they may experience chest pain, fatigue, or even shortness of breath. This blockage could progress, and the patient may experience a true heart attack. Remember, time is life. Even 1/2 hour can increase your chances of living in the event of an acute heart attack. We have developed this information to give you additional insight on the LHC procedure and help you prepare for your heart cath. Please follow your doctor's specific instructions for eating and drinking before your heart cath. Ask your physician about taking your morning medications. In order to minimize your risk of infection, please shower or bathe before your test, the night or morning prior to the test, whichever you prefer. We also ask that you do not use powder, lotions, or fingernail polish. We recommend that you bring a night bag and change of clothes. You may have to stay overnight if ballooning or stent placement is required. It is very important that you bring all your home medications to the hospital on the day of your heart cath procedure. Please understand that you may experience periods of waiting due to unexpected emergencies. Your time schedule is an estimated time. It's not the exact time of your test. It is necessary that you understand you may be required to lie in bed 4 to 8 hours after your test. This test has periods of time that you may experience discomfort. Medications are given per the physician's discretion. Mild sedation is usually provided, but you will not be put to sleep. When you arrive, check in at the main hospital entrance. You will be directed to E1 Cardiac, where you will be registered and your pre-op process will begin. A nurse will obtain consent for heart caths. Patient is changed into hospital gown. IV access is obtained, and if pre-op tests, labs, EKG, and X-rays are required, they will, for the most part, be done at this time. A physician assessment will be performed. Vital signs and medical history will be obtained. Remember, there could be a wait if there are unexpected emergency situations. Some patients are emergencies and may need immediate testing. When it is time for your procedure, you will be taken to the cath lab. You will be assisted onto a table and connected to a monitor to obtain heart rate, blood pressure, and oxygen levels. You will be prepped with a sterile prep at this time. Your body will be draped in a sterile fashion. At this point, it is important to remain still. The doctor, radiology tech, and nurse will be in the room for the entire procedure to meet your needs. X-ray images will be obtained, during which you may experience a warm sensation over your body. These images are obtained in multiple views and reviewed by doctors to check for blockages. Depending on your individual situation, it may become necessary for a balloon or stent placement. Upon completion of your exam, a closure device may or may not be used depending on patient anatomy. The device is used to shorten bed rest time. Your physician will consult with you and/or your family about results following your exam. After your procedure, you will be transported to a holding or post-cath area where you will be required to remain on bed rest for 4 to 8 hours. If your exam requires balloon or stent placement, you will be required to stay overnight. During this time, it's very important to keep affected extremities straight and head on pillow. Staff will be there to assist you with all your needs. Family may be allowed to visit during your recovery period. Before discharge, your nurse will review post-cath discharge instructions. Staff will answer any questions regarding your instructions. It is important to follow all instructions given by the staff. The Transradial provides several advantages for the patient. The biggest advantages include fewer risk of complications, quicker recovery, Patient may be allowed to sit in an upright position instead of lying flat after the procedure. The transradial remains the same except for a few minor changes. Instead of going through the groin, we numb the artery on the right hand. Most of the procedures allow us to go through the hand. Only 1 in 10 cases are unable to use the hand entry due to the anatomy. Before performing the procedure, a member of the cath lab will examine the radial artery. Once it's determined that we can use the hand, you will receive a little numbing medication allowing us to perform the procedure. You'll feel a little prick similar to what you would experience at a dentist office. The rest of the transradial basically remains the same as the groin entry. The patient is sedated, feeling sleepy but remaining awake. A small sheath is directed through the artery, providing the pathway for the procedure. After the procedure is completed, the catheters are taken out and a small band is wrapped around the wrist. A small balloon is inflated and the sheath is removed. You will be placed in an upright position. You'll be taken to a holding area for observation for 90 minutes to 2 hours before being allowed to go home. A recovery nurse will check your vital signs and remind you not to use your wrist during this observation period. A family member will be allowed to join you in the observation area. Thank you for choosing PIKEVILLE Medical Center. It is very important that you understand your heart and how to live a healthy life. After a diagnosis of heart disease or a heart attack, many patients are confused and scared. They're afraid that exercise may be too stressful, and they don't know how often or how hard to exercise. After a lifetime of high-fat diets, patients are unsure of how to maintain a healthy eating plan. The PIKEVILLE Medical Center Cardiac Rehab program is designed to help heart patients make positive lifestyle changes in a professional, safe, and supervised environment. According to the American Heart Association, research shows that cardiac rehabilitation patients who are exercise trained are less likely by 26% to suffer from cardiac death than patients who only receive general care. What happens in cardiac rehab? You and your healthcare provider will decide on an exercise program that works best for you. Weekly exercise sessions, counseling, and education will be offered to help you understand your condition and how to manage it. Exercise equipment you may use includes arm ergometers, treadmills, and stationary bicycles. During exercise, you will wear a small heart monitor that will enable trained RNs to monitor your heart rate and blood pressure. Within 2 or 3 weeks, you should begin to see results. In order to begin your cardiac rehab, you must first have a referral from your family physician, cardiologist, or cardiothoracic surgeon. Thank you for choosing PIKEVILLE Medical Center for your heart health.